L&M Hospital and Ledge Light Health District to bring you an update on COVID and where we are. We had done an informal panel months back, and we wanted to bring you up to speed on what we've learned and where we are facing COVID. And the first person that I would like to introduce today and thank them for being available to us this afternoon is Patrick Green. He is the president and CEO of L&M, which is part of Yale here in New London, Connecticut. And I'd like to welcome Patrick, and he is going to introduce our panelists. And I would also like to welcome Steve Mansfield, who is the director of Ledge Light Health District, an integral part of our fight against COVID. And we will all be available to answer your questions in the coming hour. And I'm going to turn it over right now to Patrick. So thank you, Patrick, for being with us.
Thank you, Senator Summers, and thank you for your leadership, as well as you, Senator Formica. I think you all have partnered with the entire region to help us battle this horrible disease, and we couldn't express our gratitude for your leadership. It does give me a great honor and privilege to introduce my colleagues who, without them, on the clinical forefront, advising us, working with our staff, working with our physicians to help us battle this very unpredictable virus. I'll start with Dr. Kevin Torres, our Associate Chief Medical Officer. Kevin is an emergency medicine physician, and I have to say he has led our testing capabilities. It was an integral part of our surge capacity planning, and I'm so grateful for his expertise and leadership. Also, you introduced Steve Mansfield. Our collaboration and partnership with Ledge Light has been phenomenal, and I want to also introduce him and thank him for his leadership. Donna Nucci, our infection prevention director at L&M, she has is the infection prevention expert. We look to her in many fronts to keep us educated on the new trends, and it's ever changing. And she also has been lock in step with us. It's just amazing to think about how the information was changing so readily, and she was right there with all of us on the front lines. And Dr. Rick Martinelli, our medical director for the Yale New Haven Health System for infection prevention. Rick is just invaluable to our health system, and he has been an expert working with all of us through all the infection prevention and really educating us on this virus throughout, and it continues to be a strong partner to all of us. And Katie O'Leary, our Vice President of Post-Acute Care. Katie is my colleague and partner with our post-acute care services, including the VNA here in our region. So very happy to introduce them to you, Senator Summers, and I'm also here to answer any questions, but I'll end there and pass it back to you. Thank you.
Great, thank you. And then I would like, if we could, just have Steve Mansfield, who's the director of Ledge Light, be able to say a couple words, and then we move on, and we're going to have each panelist just talk about what their role is in COVID, and then Dr. Torres is going to give us a brief summary on what we learned about COVID in the past few months, and then we'll get right into the questions. So Steve, do you mind saying a few words about Ledge Light Health District?
Not at all. Thank you, Heather. I'm really glad to be here, happy to be part of this panel. Just a little bit of background. Ledge Light Health District is the local health department for 10 municipalities in southeastern Connecticut. We've been working hard during COVID-19 with all of our community partners, and I think we're especially lucky in southeastern Connecticut to have such great relationships with all of our partners. I really appreciate being here, and I'm happy to answer any questions people have. Just a quick update on what Ledge Light Health District is doing now. As everyone knows, contact tracing is one of the biggest things associated with COVID-19 now. And like all the other health districts in Connecticut, one of the biggest challenges we face is conducting effective contact tracing And we've been doing that since the beginning of the pandemic. And we've got about a 60% success rate in contacting cases and contacted cases, which is much higher than the state average. And again, kudos to my staff and to L&M and all our other partners who make that happen. The other thing we're really involved in is the governor's sector rules. As you may know, we're in the middle of phase 2, hopefully moving toward phase 3 sometime in August. I will say that local health departments and even the state health department were not included at the very beginning of the pandemic in the development of these sector rules. But thanks to Senators Summers and Formica, who continue to advocate for local public health participation, not only in this process, but across the board. So we now do have a seat at the table. I sit on one of the governor's reopening subcommittees, and we provide a public health perspective when they're talking about what we should open and how we should open things. And lastly, as we move closer toward the development and potential availability of a vaccine, Ledgelight Health District is preparing to mobilize our mass vaccination plans, which we utilized during the H1N1 crisis about 10 years ago. And although the method of distribution of vaccine is still unclear, we fully expect that local health departments will have a significant role in that when it does happen. So again, happy to be here, and I'm looking forward to doing my best to answer any questions people may have. Thanks very much.
Great, thank you very much. So I think we should go through and look at the panel and have them just briefly describe what their role is, although Patrick has done that, but we'll let them speak for themselves. So first on the list I have, and this is in no particular order, is Dr. Kevin Torres.
Thanks, Heather. So as Patrick said, I'm an emergency medicine physician at Lawrence Memorial Hospital. I'm currently the Associate Chief Medical Officer as well. During COVID, I ended up getting involved in a lot with the testing. Everybody's heard about testing through the news and everything else. So that's become a big part of what we've been doing and help when we had a lot of patients working on our surge plans during this time at Lawrence Memorial. And lucky enough, honestly, to work with many of the folks on this call. I was able to meet a lot of these people and work with them, people that we might not have dealt with previous. So it's been a good team.
Great, thank you. The next person I have is Dr. Richard Martinelli.
Hi, good afternoon. I'm Rick Martinelli. I'm an infectious disease physician with the Yale School of Medicine, and I serve as the medical director for infection prevention for Yale New Haven Hospital, and then also the medical director for Yale New Haven Health. And infection prevention, I think Donna would agree with this, is a really critical role in healthcare. When patients, when staff come into our environment, we always worry about what the safety of our patients and our staff is. And the role of infection prevention is to create the safest environment possible to make sure that our patients and our staff alike don't pick up infections when they're here receiving care within that environment. The way that we do this work is really in a very supportive, collaborative role. And we work not only with our physicians and with our nursing staff, but we also work very closely with our engineers to make sure that the air and the water in the environment is as safe as possible. We work with our housekeeping staff, our environmental services professionals, to make sure that the environment is as clean as possible. And we work with really the whole team, my colleagues who are here on the call with us, to make sure that we create that environment that's really the safest possible for our patients.
Great, thank you very much. Then we have, you mentioned her, how about Donna Nucci?
Hi, I'm the infection prevention manager for both L&M and Westerly Hospital. And as Dr. Martinelli said, I think that it's been an honor to be able to work with Dr. Torres and certainly Mr. Green at our delivery network. We are a system department, so I'm very fortunate I don't have to work out here by myself. We have weekly and during the COVID pandemic in the beginning, daily meetings every day to look at all the new evidence and really decide as a system. We start down at Greenwich Hospital and go all the way to Westerly Hospital. So a team of infection preventionists that works with Dr. Martinelli to review all of the evidence. The team here at L&M is so dedicated. I can't say enough. I've been in infection prevention for over 10 years, and to come into this team here at L&M and see the dedication, questioning attitude, Like Rick said, we really work with EVS, work with every single segment of who provides care here at the hospital, not just the front-facing staff. I think it's really important for people to know that there's a huge team working behind the scenes to make sure that everything is safe. So that's my role, is to bring everything together at the system, and certainly to work with Steve Mansfield from Ledgelight and Chris Magnuson. They have been unbelievable in really having sometimes almost day-to-day contact about what's going on in New London. And both of us have been relying on each other for information and really coordinating an effort to make sure that New London County is kept safe. So it's been an honor to work with Steve and his team as well. They've done an outstanding job here in New London.
Great, thank you. And we have Kathleen O'Leary.
Hi, good afternoon, Senator Summers and Formica. I'm Katie O'Leary. I'm the Vice President for Post-Acute Care Services for Yale New Haven Health System. I'm a very proud nurse and feel very privileged to serve and work with patients and providers before and after hospitalizations in nursing homes, home health agencies, rehab facilities, and other non-acute facilities and agencies. So I'm happy to answer and pitch in with any of the dialogue today regarding any questions folks might have regarding community-based COVID concerns that they may have that are associated with those types of services.
Great. Well, thank you all for being here. It's great to have you, and I think we'll just dive right into the questions. So many of the folks that we have a lot of questions. So what we've tried to do is consolidate some of the questions because a lot of them are very similar. Some of the questions are not really pertaining to what we're discussing today, so we'll have to answer those off to the side at a different time, but we'll just get right into them. So the first question, and these are not in any particular order, just pretty much the order that they came in. So the first question, there seems to be a lot of confusion or uncertainty about social distancing and masks, when to wear a mask, when not to wear a mask. Some people have been told it's okay to not wear a mask outside. Others have been told wear a mask outside. And could you speak to that? I think we would like to hear that from the clinicians and also from Ledgelight. We know that we've had many folks visiting our area that are not wearing masks in very close contact, like in downtown Mystic, versus taking a walk at Bluff Point when there's no one around. So I think that is a question that we repeatedly had today. So could you speak to that? And whoever would like to speak first, please feel free.
Senator Summers, I'll take a first shot at that. So first I'll say that, the governor's executive orders for mask wearing are designed very specifically to prevent the spread of COVID from one person to another. So keeping that in mind, the more that you are in contact with other people, especially close contact without a mask, the more likely you are to contract COVID-19. So the mask provision in the governor's executive orders is designed to prevent that transmission. So in a public space, if you can't maintain social distancing of at least 6 feet, you're required to wear a mask. So there are situations where you may be, as you mentioned, walking at Bluff Point, no one is around. There really isn't any practical reason from an epidemiological standpoint to wear a mask, but you should have one, because if you come in contact with a family walking toward you, it may be impossible to prevent the transmission or prevent that close contact. So it's pretty straightforward, and it's one of the most important things we can do to help reduce the morbidity and mortality associated with COVID-19.
Okay, Dr. Martinelli, do you want to speak to that also as an infectious disease specialist?
Yeah, I think Stephen said it exactly right. Masks are really a critical part of making sure that we don't transmit COVID from one person to the next, and that's really complementary to, with social distancing. And so it's, we don't do one or the other. We actually do our best to do both. When you are outside and you're not around anybody, it's fine, not to wear a mask at that point. However, you should really have that mask with you because if you may come across somebody, you want to be wearing that mask if you cannot maintain that social distance. And likewise, I think something that we've seen in stores or on, walking down the street is times when people aren't wearing masks, and that unfortunately is not appropriate. We need to be wearing masks anytime we're potentially around people, and so it is really critically important that people bring masks with them and we use them frequently.
So in other words, if you're walking downtown Niantic or Mystic or on a boardwalk where there's a lot of people, you should be, just because you're outside does not mean that you should not have a mask on.
That's correct.
Okay, that is very important for people to have clarity on. The next question I have is from a patient. It says, I have a visiting nurse coming to my house for wound care. What is the proper protocol? Should I be wearing a mask when she visits? She has a mask when she visits me. Can you speak to that so I can make sure that I am safe?
Sure, I'll take that one. And if Rick or Donna want to add anything additional, both the nurse and the patient should be wearing a mask. That's the safest practice for everyone, is for, just like Rick just mentioned, just like being out in the community where there's people that you don't normally, that you're not normally interacting with in your own personal home, you should be absolutely wearing a mask, and so should the nurse. If you don't have a mask available, any visiting nurse should be able to help you with that. Most of the time, it's just one that's left in the home and is used for the duration of your care within the VNA services.
And the VNA is part of the hospital. Can you speak to that? So they would be following the protocols you have?
Sure. Visiting Nurse Association for Southeastern Connecticut is part of Lawrence Memorial Health System, which is part of Yale New Haven Health System. So we do currently have 2 home health agencies within our system, with one of them being in the New London area, servicing the majority of the patients who are taken care of in that space. So we take a lot of pride in making sure that we're following all the recommendations that are put forward by the Infection Prevention Department, largely under the leadership of Dr. Martinelli and Donna and many others who are involved in making sure that we're keeping our patients and our staff as safe as possible.
Okay, and a follow-up to that, because it kind of goes along here. The other question I have been asked is, for home care patients in the New London area, how many do we have that are positive for COVID currently?
Sure. Currently within VNA Southeastern, I can't comment for any other agencies that are around, but for the agency that's part of Yale New Haven Health System, we only have 2 patients who are COVID positive or presumptive COVID positive. And across our system within the home care services, we have less than 30. So it's really not very prevalent in the folks that are being taken care of in through home care agency services at this point.
Okay, I don't know, Mr. Mansfield, do you have anything you want to add to that? I know you have interaction with the VNA or...
Sure, just very quickly, although local health departments aren't responsible for determining what the appropriate personal protective equipment is, our communicable disease supervisor, Chris Magnuson, has been working closely with the folks at L&M. And based on her observations, L&M's PPE practices are just in right conformance with the standards set by the CDC. And the PPE shortage at the beginning of this pandemic put a huge strain on many organizations, including Ledgelight Health District. But thankfully, the current supply is relatively robust, except for N95 masks, which continue to be in short supply and difficult to obtain. But yeah, I think as Donna said before, the relationship between L&M and Ledgelight is very strong, and I think they're doing exactly what they're supposed to be doing.
So on the VNA in Southeastern Connecticut, where we've had 2 suspected COVID positive patients, how many people does the VNA in Southeastern region, how many people does it serve?
Their average census is anywhere between 700 and 900 patients at any one given time. Through this entire pandemic, they've taken care of a total of 32 COVID positive patients. So again, the numbers are very small in terms of the patients that we're taking care of in these kinds of circumstances. So, we're very cautious with these types of cases, especially if they're presumptive and they haven't been confirmed yet. And sort of as Mr. Mansfield said, we really pride ourselves in following the CDC guidelines about safe practices for both the patients and the staff.
Great. Okay, I've been asked here, there are a lot of questions about children going back to school. How easily transmitted is the virus on objects? And Are young children transmitting the virus to other children? Is there concern with children transmitting to teachers? And will we also host school? That's asking us if we'll have another meeting on schools, which we will try to do later. But can you speak to, children getting the disease, transmitting the disease, being carriers of the disease? I know that was something that was initially out in the forefront. So whatever clinician would like to take that, please go right ahead.
I'll jump in and try to address that. Well, I think early on in the pandemic, I think we all heard how it wasn't clear if children could potentially get sick or if children could potentially transmit it. We know that both of those are true, and we have seen some instances of even very young children getting ill. Fortunately, that is relatively uncommon, and also fortunately, children aren't impacted quite as much as what we've seen in adults. Certainly we've seen some instances where children are very sick, not only with COVID itself, but also there's an inflammatory condition that we've seen rarely, but we've seen a number of times in children who appear to have recovered from COVID, the acute illness, but then developed that inflammatory syndrome. It's not clear how readily kids who have COVID can spread it either to other children or potentially to adults. We do think that's possible, and there is some data suggesting that it may not be as common as adults infecting other adults. But this is an area where, since schools were canceled back in March, that we really don't have a lot of experience with. And so I think that is something that we're looking for, an area where more research needs to be performed and we need to get more experience. As far as how the virus is transmitted and surfaces, we do think that the virus is primarily transmitted from one person to another through respiratory droplets. And we are still concerned that those respiratory droplets can contaminate surfaces, and then somebody with their hands can get virus on their fingers and potentially infect themselves when they touch their eyes, nose, or potentially their mouths. It's not clear how much of COVID transmission occurs through surfaces, but of course, cleaning those surfaces is very important. And perhaps as important or more important is making sure that people have clean hands in case they did touch something and picked up virus on their hands.
I see. So washing your hands in school with little kids would be very important.
Quite important, yes.
Okay. And I'm hoping that if this is well attended by many watching it or watching it later, that as we get closer to school, we could do another one as we learn more and as schools put their protocols in place. So the next question we have is, since smoking is a risk factor for increasing death from COVID, I'm not sure if it is or not, you can answer that. Should the state reconsider legalizing marijuana? Anybody want to take that? I guess they would be suggesting that you eat marijuana, not smoking it. So we could talk.
I can try to touch on that.
Sure.
So smoking is bad. Vaping is bad. These things we know, and being exposed to any type of smoke, whether it's marijuana or tobacco or something else, is deleterious to people's health, and so we should try to avoid it. I'll leave it to the politicians to discuss whether or not how that integrates into the legality of marijuana in the state of Connecticut, but we should try to avoid smoke of all different types.
Okay. I have another question is, what do you see from a clinical perspective? And this really could go to Dr. Torres, to the clinicians, to Ledgelight, as the reliability of the COVID tests, the sensitivity, and are you experiencing extended times to get the results back? What is a normal turnaround time? And is there a backlog? That's all for testing.
I can comment on locally how we're doing with testing. So testing is continually something that we have to revisit. Currently, we have a pretty good system where we run a lot of our testing through our laboratory at Westerly Hospital. We've had, thanks to being part of the Yale system, we've had multiple platforms that we can run our COVID tests on. We test all our patients that get admitted. We're doing testing on patients that for their pre-op before they have surgeries done. Our surgeries are up and running now, and we're able to test folks before they have surgery, usually 2 to 3 days before, to make sure they're safe to have their surgeries, and that's been going well. So we continue to watch the testing. As far as a backlog, I think what you hear on the news a lot, depending upon which testing service you're using, when you start sending them out to some of the larger labs, some of them are looking at almost similar to what we had when we first started. We're getting a backlog of 5 to 7 days. So that when you have that kind of a wait, it becomes a little less helpful for the information. But it is something we continue to look at. Locally, our lab is run by Nicole Gomes, and she works with Peter Marone with the Yale system. And, you know, it's a constant thing. They're trying to look for the next platform to try and stay ahead so we can take care of our community.
So as far as the testing reliability, can you speak to that? I know that that's part of this question. They're saying that sometimes people are getting false negatives, and what is the normal turnaround time for somebody who gets a COVID test, and how easily are they available? It's all part of the same question. Sorry, there's a lot there. So can you speak to that? And actually, you could roll that into the next question, whoever wants to answer that, which has to do with, there's a lot of confusion on traveling. And if someone has to come to the state of Connecticut, and Ledge Light, please weigh in. You know, it says the governor's order, I believe says you have to have a COVID test 72 hours before you come to Connecticut. And if you don't, when you come here, you have to quarantine for 14 days. There has also been some suggestion that even if you have a COVID test 72 hours before you come to Connecticut, that you should stay in place and get an additional COVID test. Is that the case? Where would somebody traveling get the test? Can you all speak to that? Because that is especially now in tourism season, it is a big question.
Sure. Senator Summers, I'll take a first cut at that, or at least part of it. So the governor's executive order, although it does have a provision for testing, that's really not the thrust of it. That's not what we want people to be doing. We want people who are coming from those hotspot areas to self-quarantine for 14 days. That's the best intervention method or prevention method that we can put in place. The reason why the governor, and I should say in my work with DECD on the reopening committee, we had these conversations. The reason that the governor's office put in place that 72-hour prior to travel testing criteria, or for individuals who, for whatever reason, can't quarantine or will have a very difficult time quarantining. And one of the reasons we don't want people to rely on that 72-hour testing is because the incubation period for COVID-19 may make that waiting period kind of useless. So let's just say I'm in Utah and I get tested 72 hours prior and it's negative. Then I go to the airport and then I get on a plane and I come back to Connecticut. That means I have the potential for being exposed wherever I was in Utah after the test was taken, or on the plane or the airport. So you're potentially still bringing COVID into a relatively non-hotspot area. So people shouldn't rely on the 72 hours and think that that's a catch-all. The most important thing is to honor that 2-hour voluntary quarantine provision.
The 2-week quarantine.
Correct.
Got it. Okay.
14 days.
Doctor, do you want to speak to that? Anybody? All right. What would your clinical advice be if you're traveling from another state and you're coming here? Our executive order says one thing, but there's been a lot of confusion on that. I actually had somebody contact me about a wedding that they're going to have serious issues with the restrictions. So could you speak to that from a clinical perspective so people can maybe make a better informed decision?
Okay. I can jump in on that. And, I think that this is really good advice that we're hearing from the state. I think there does need to be some additional clarity to it, but, we are seeing quite a bit of COVID that's starting to circulate in many of these other states. And really what we know, the reason why it's circulating is because of the lack of use of masks, because of the lack of social distancing, because of people really being in close contact with each other. And so somebody being in one of these high prevalence states where we're seeing a lot of COVID, that in its own right is a risk. And of course, travel, it's really can be almost impossible, if not impossible, to keep yourself properly social distanced. Of course, you may be wearing a mask, but then that social distancing can be very difficult if you get placed on a plane, for example, next to somebody. And so when you come back into Connecticut, or we have others coming into Connecticut, I think it is good advice, from the state government, where we need to have those individuals self-quarantining for that period, and really for those full 14 days, because of how long it could take after the exposure until you may become sick with COVID and potentially contagious.
Dr. Torres, are you seeing folks coming into the hospital that have traveled getting sick with COVID today?
So actually, so we've recently had a bunch of positives, and about 20 of them are all attributed to travel outside to these areas that we're concerned about. So it's certainly something we need to take serious and consider your travel plans.
Okay, so people have heard what the experts have said as far as travel. Would that also be the case if you are somebody who travels for work to one of the hot spots for a day and then comes back? A lot of our employers have questions as far as that's concerned. Would we still follow the same guidelines? As far as you travel, let's say you're traveling to a hot spot in Ohio for the day for a business meeting, and then you come back. You would suggest doing a Skype meeting, I take it.
Yeah, I would suggest doing a Skype meeting.
Okay. We've also had some more clinically detailed questions that have come in. Please speak to how the Eastern region is situated in terms of supply of remdesivir. I'm not sure I'm going to say that right. Steroid therapy and plasma therapy for patients suffering from COVID. Would anybody like to speak to that?
Yeah, I'll take that. Yeah, so the question is about some of our therapeutic approaches to COVID, namely remdesivir, steroids, and then also convalescent sera. And right now, those are three types of medications that we do have in good supply. Remdesivir, which is a medication that really just became into use for COVID a few months ago, has been shown to be effective in not only decreasing how long patients sick with COVID stay in the hospital, but also it's been shown more recently to decrease the risk for death for those with severe COVID infections. And so it is a medication that clinicians are using really as much as we can in those who have the most severe manifestations of COVID and are hospitalized. There were supply issues with it early on, and even up to a few weeks ago. Now that seems to have been getting better, and so we hope that continues. For steroids, that has not been an issue, and we have a few different types of steroids that could be used. And so if we are running short on one, the other types will be available. Convalescent sera, is a blood product that's been used to treat people who have been hospitalized with severe COVID. And I have not heard of any shortages of that. I don't know if Dr. Torres or Mr. Mansfield have heard of any.
No shortage on that I'm aware of.
No, neither have I.
Great. Thank you for that. The next question has to do with probably for Mr. Mansfield, is asking, do you have any anticipation on the loosening up of the restrictions, specifically for beauty procedures that would require not wearing a mask or the removal of a mask coming up?
So the DECD reopening committee was recently considering that. There was a recommendation to allow the removal of masks only while certain services are being performed, like trimming beards, facials, makeup, tattoo, and so forth. That was not approved. That hasn't been formally released yet. Apparently it will be tomorrow, but there is currently there are no plans in the works to ease those restrictions during the phase 2 reopening. Likely it will happen in phase 3. And as I said earlier, phase 3, the date for phase 3 implementation will probably be announced sometime in early August.
Okay, great. There are some questions concerning, is it more appropriate if we're sending our children back to school in September to have them wear a plastic face shield versus a mask? Can you speak to that?
Yeah, I'll touch on that. I think masks is really where we have the best data for their effectiveness. And so as a baseline, it's really important to have everybody, wearing a mask, as they should. Face shields very likely provide an additional level of protection. We know that with other coronavirus infections, such as SARS that we saw back in the early 2000s, then also more recently MERS coronavirus, we know that the face shield can actually be a very effective way to help prevent infections. So we think that face shield is actually complementary in addition to wearing a face mask. I think the most important thing is really that we follow the instructions that were given from both public health and from the schools. And I think another thing that's going to be really important with our kids getting back to schools is making sure that all of the parents of children are really supporting their schools and helping to communicate with their kids about what the new normal is and about how we wear masks, and making sure that we're all on the same page so our children are hearing a clear, consistent message.
Okay, great. I don't know if anybody else wants to weigh in on that. That's one that came in. There is another question which is coming up repeatedly. It is asking, with all of the talk about an election in November, is it any less safe to wait in line to vote versus waiting in line to purchase something at Target?
You don't have to go to Target?
Well, it doesn't have to be Target. It could be Target. I guess it could be a grocery store. I get the person's point. And I would just like to say that the legislature is looking at trying to come up with a way. Right now in Connecticut, you can vote by absentee, but there's very specific criteria as to what that reason is that you can vote that way. I know both myself and Senator Formica support what we call a no excuse absentee ballot, meaning you can absentee ballot for any reason. COVID would be one of them. You request the absentee ballot yourself, the registered voter, you get a mailed in application, and then you mail in your ballot. So that would help those who are in the high risk category not have to wait in line, etc. So I just wanted you all to speak to that if you could. That is a question that there's a lot of different views on that. There's people saying if you go vote and you're putting yourself at risk to die from COVID. So I want to have the clinicians weigh in on that, please. Well, I don't want to. This person who sent in this question did.
I think, as Donna was suggesting, there's really no difference in risk between going to Target, going to the grocery store, or going to vote. And perhaps, voting may in fact be more safe than going to any of those areas, because I would expect that the way our polling stations will be set up for our elections is that there will be systems in place for social distancing. And there will be monitors there who are helping to guide people to ensure that social distancing is being carefully followed and that everybody is wearing a mask. There's really no excuse as to why somebody may not wear a mask. And so they should be wearing a mask, they should be socially distanced, and they should be, feel comfortable about going to vote. I do think, really the most important thing is that people do get out and vote, or do choose that option of an absentee ballot.
Okay. Does anyone else, Dr. Torres, do you want to weigh in on that?
No, I would just agree with Rick. I mean, it really doesn't matter where you are, as long as you should be doing the right thing, masking and washing your hands, and that doesn't matter why you're there. It's you should be following the correct guidelines. That's what's most important.
And I'll just chime in just a little bit more. I think when people make decisions about where they're going and what they're doing, they should always ask themselves, is this necessary? Do I need to do this, or is this optional? And if there's an easier option that puts you in less contact with other human beings, then it may be a good option. So my mom and dad have been isolating or quarantining themselves for over 3 months now, and I do all the shopping, but I try and get in and out as quick as I can because it's not the safest place to be. So I think making that determination for you and your family about what do I need to do and what do I want to do, and that should help guide your decision.
Great. Well, that's good to hear that it's not what you're doing, it's where you are and how you're protected and how you socially distance. So thank you for that. So we have a few more questions here. One of the questions, I'm not sure if you'll be able to answer it, but it came in, was from a clinical perspective, are you expecting an uptick in the virus this fall as we hear on the news?
I am expecting it. We know from work that's been done that the overwhelming majority of people across the United States, still have not been infected with COVID. And while that's really great news, some of the problem that comes along with that is we expect that all those other people who have not yet been infected are likely very susceptible to getting infected. And because there's such a high percent of people who haven't been infected yet, that really places our state, our community at risk for seeing this virus come back. I think, with what we're experiencing in Connecticut now and what we've seen in, states like New York and Massachusetts, Rhode Island, where people paid close attention to social distancing, close attention, to wearing a mask and washing your hands, we are able to flatten that curve. We are able to control how this virus is impacting our community, but we are at great risk. And if we aren't as serious about these measures to prevent the spread of COVID, we're going to see it come back and lots of people still left to be infected.
Yeah, I would say as well, we working with folks like Rick, locally, Donna and I, and the rest of the team, I mean, we continue to stay alert, although we haven't had many COVID infections in the hospital at Lawrence Memorial or Westerly over the last few weeks. We still have a report out in the morning about our COVID infections and what's going on around us. Our surge teams still discuss how we would better our plans from things that we learned from the last few months. So we're ready in case that changes. And we likely will see an uptick come the fall and the winter.
Okay, yeah, it's important to watch some of the states surrounding us. So I think it's important to watch where the numbers are nationally and what that positivity looks like. So I think as a unit in New England, New Jersey, and New York in general, like Rick said, have done really a great job. But it's important to watch that and to be very aware. I think as a system, we're very aware. We talk every day, where are Greenwich's numbers, where's Westerly's numbers, and then we can kind of coordinate all of that and speak to Steve's team to see if we are seeing any movement at all on any numbers. So I think that we inevitably, as we all start to move some of our activities indoors, we'll see an uptick. But we're working every day to try to, realign things like our waiting rooms and our visits to ensure that people don't have to interact with each other when they visit.
Okay.
Yeah, I concur with all of those opinions, and I'll say, what we have going against us now is the fact that we're easing into a reopening. We're done with phase 1. We're in the middle of phase 2, moving toward phase 3. That's just going to allow people to interact more, and pile on top of that the fact that people are tired. People are fatigued. They're tired of this pandemic. I'm tired of this pandemic. So I think that naturally leads to complacency. People just want it to be over, so they'll grasp at anything that indicates that things are getting better. People want things to be getting better. But the more we allow people to congregate, and especially with a potential for schools to reopen to a greater or lesser extent, that will just likely contribute to the probability that cases will increase. So I think it's going to happen, but I think we just have to remain diligent in sending our message to people that we're still in the middle of this. This is a marathon, not a sprint, and we have to keep our guard up.
Okay, I have a few more questions and we'll try to get them in. The first has to do with the supply of PPE. There was a question that came in concerning what are we doing? Is there a shortage of PPE? And what are we doing to prevent us from running out of PPE? Should this go forward? So we see the uptick that you're all anticipating.
So I can start by speaking as far as Lawrence Memorial and Westerly Hospital go. We currently have the appropriate PPE. Again, being part of the Yale system, we've been able to get quite a bit of PPE and stay ahead. I know Steve mentioned it was difficult right at the beginning, but we continue to look for different channels to get more PPE. The other thing that we added was a lot of telehealth that we've been using in the hospital, and that's been used. We're using that in the ICUs and on the medical floors, and so it allows us to interact with our patients a bit more without having to put all the PPE on. It doesn't mean we don't go into the rooms and see the patients, but it does give us another option to take care of the patients and not have to use all that PPE. So people are being proactive and looking at ways to take care of folks and not have to use all the PPE. I don't know, others can comment as well.
Okay.
So what we've seen at Ledgelight Health District, we are the entity in Demas Planning Region 4 that goes up to the Mohegan Sun and gets the supply of PPE and then distributes the PPE to a number of different entities, hospices, private providers, dentists, and so forth. At the very beginning of that PPE distribution system, just about everything that we put in and redistributed, it was gone in a day or two. Now we've got a pretty large stockpile of most types of PPE, from face masks, gowns, KN95, surgical masks, and so forth. So there isn't a lot of demand out there for the providers and the entities we're responsible for providing to PPE. I think people have what they need, but I think it's good that we're developing a stockpile. Should we see that surge in the fall, we'll be much better prepared than we were at the beginning of the pandemic.
Great. Thank you for that. That's good to know. I know that was a worldwide shortage at one time, and hopefully we are managing it as best as we can. Also, with the increased testing, you will have an ability to know what patients are COVID positive when you didn't know that previously. So you had to have your full PPE. I have a question. I'm not sure if Patrick is still on concerning the hospital. It has to do with how is the hospital handling hazardous duty pay and workman's comp for potential employees that may have gotten sick from COVID from the hospital. That seems to be a question that has come up. Is Patrick still on?
Yes, I'm still on, Senator. We do not have a hazard pay policy.
That would be a contract, correct? In a union contract?
Yeah. Any of that compensation for our collective would have to be part of our collective bargaining. However, we did offer all of our staff a special COVID Achievement Award in May, and that was well received by our staff. And that was in the midst of a significant downturn in our revenue, and while we were racking up significant financial challenges due to this COVID pandemic process. As it relates to workers' comp, we follow all state guidelines and labor requirements there. So we're going to honor and respect any of that process and work with our staff and human resources to follow all rules and policies around workers' comp.
Great, thank you. I know that's a question that comes up for a lot of employers in these difficult times, so I'm glad you were able to address that. We have a couple more questions. If you can stay over just a few, we started a little bit late. I also wanted to apologize. Senator Formica is in the middle of a move and he's having some technical difficulties. So he is here listening and in spirit, but for some reason we can't get that new internet to be working properly. We wanted to touch for a minute because we've been asked repeatedly by some, and I know that I had spoken to Ledge Light about this. Please address the enforcement of masks. How do we make people wear masks is a question. And secondly, can the clinicians and Ledge Light please weigh in on social distancing at beaches? Is it necessary?
So Heather, I'll take the first part of that question. Just so it's clear, when the governor put out the different executive orders, he made two entities responsible for enforcement. One is the local public health director, and the other is the municipality. Each municipality was asked to appoint one specific person as the contact for any complaints regarding violations of the governor's executive order. So Ledge Light Health District is responsible for restaurants, tattoo parlors, cosmetology, barber, and a couple of others, and essentially everything else falls on the falls under the umbrella of the municipality. So if we get a complaint here at Ledge Light Health District about a restaurant where no one's wearing masks, the first thing we do is make contact with them via phone, speak to the certified food manager, make sure they understand what's going on and what the regulations say they need to do. Most of them are compliant and they listen. If we get a second complaint or we observe something during one of our routine inspections, then we follow up accordingly. In some cases, public health orders need to be issued, but honestly, we have more than 1,000 regulated establishments in our jurisdiction. And if we issued public health orders for every complaint about people not wearing masks or social distancing, it is literally all that we would be doing. Because it's a legal process and it's relatively straightforward, but the paperwork involved is daunting to say the least. And as it goes the same for municipalities, I think a lot of our municipalities don't have the manpower to go out there in the field and say go to a hardware store to check up and see if it's true that the clerk isn't wearing a mask. It's just so widespread, and the governor's executive orders don't have a lot of teeth as far as monetary penalties and so forth. So it is, I'd say, a shortcoming of the whole system. Enforcement is very, very difficult, both operationally and from a workforce perspective, especially. But we are required to follow up on all of those complaints from either a municipal or a public health perspective, and we do our best to do that.
I appreciate that. Does anybody want to weigh in on the beaches? Social distancing at the beach.
So I think if you're on the beach, good news is that you're outside, and we do think that being outside, especially if there's a breeze, is going to help protect you a bit. But it's still critically important that we need to try to keep our social distance. We should be wearing a mask if we're not if there's others on the beach and we're not able to maintain that at least 6 feet of distance. And so the rules still apply. If you're outside, if you're on a beach, we still need to be wearing masks. We still need to be keeping our distance from other people.
I think one of the important things is to look at the enclosed spaces, so changing rooms and restrooms. I did visit a beach in Rhode Island this past weekend, and I think that's where I saw kind of a lack of social distancing and proper PPE was in the closer spaces, which are unventilated. So the greatest risk is going to be when you decide to possibly visit other areas of the beach, either to change or to use a restroom where somebody might not wear a mask and there's a close quarters.
Okay, there is another question that came in through Senator Formica. And again, Senator Formica is listening. He just can't get his face up here. And, as I said, he's in the middle of a move. So he is well-versed, and we have met continuing with Ledgelight. He's doing a great job as far as COVID is concerned. And you just can't see his face. So a question came in about how safe is it to have servers be actually wearing gloves when they're serving people there for dinner? There are some people that are concerned that, how often is the server changing their gloves? How do you feel about that from an infection control policy? If you would like to weigh in and Ledgelight, that would be great.
So yeah, I'll jump in first. The Connecticut Public Health Code and the FDA Food Code, although gloves are allowed, they're not considered to be the best method of preventing foodborne illness. So we, as part of that subcommittee I was speaking about before, we lobbied hard against the mandatory gloves for servers and bartenders, because we know that the glove use is frequently abused. People don't wash their hands enough when they have gloves on, and it's just as easy to spread germs from glove surface or your fingers without the gloves. So eventually DECD and the Rules Committee decided to change that. They're formalizing that. It will be announced, I believe, before the end of the day tomorrow. So bartenders and servers will no longer be required to wear gloves, but rather rely on hand washing as the primary means of sanitizing their hands.
So you're saying that that order is coming out when?
The DECD has said before the end of the workday tomorrow, those revisions will be made to the phase 2 sector guidelines.
Okay, so that's important to know for those who are maybe going out to dinner, that if they see their server without the gloves on, that there's a reason for that, correct? So people aren't saying, why did they have gloves on last week and now they don't have gloves on this week?
That's right, and the decision has been formally made and conveyed to all the health directors across the state already. So we're already not enforcing that, but it will be formally released in the form of a revised Sector 2 guidance document for food service establishments.
Great. The next question that we have coming in, and this is through Senator Formica, is of those that are 65 and older, what is the true risk if you are somebody who's of that age group, but that you don't have any underlying conditions? The way that is actually worded here, what are the odds of people over the age of 65 with no significant underlying health conditions getting the virus, being hospitalized, versus those who are under 65? Is there any data that shows if you are a young person that your outcome is going to be significantly different than if you are older?
Yeah, so I'll try to answer that. For adults, it's not clear that age is a risk factor for getting sick, but we do know that very clearly that age is a real risk factor for having more severe disease. And the older you are, the more likely it is that you will have severe disease, and the more likely it is, unfortunately, that you will potentially die from COVID if you get it. And the good news is that overall, when we look at everybody who gets sick with COVID, the risk of dying from COVID is significant, but it's a relatively small number. It's probably about 0.2, maybe 0.3% overall. That is about twice to maybe 3 times what we see with influenza, which we know is very, has a very significant impact on our population, on our community each year. We do know that for those who have unfortunately died due to COVID, the majority of them are actually among the older ages. I think that there was some recent work from CDC showing that it was about 75 to 80% of those who passed away from COVID were actually in the 65-year age and older. And, of course, as we know from the news that we see every day, there's quite a few Americans who have died already, well over 100,000, around 140,000 who have passed away since COVID came into the United States.
Yeah, I think I would piggyback on what Rick's saying. Something that we've talked about is, people ask what they can be doing. Folks that maybe have diabetes or COPD or any other health issue, it does give you a bit of a higher risk. Also, being overweight, they're starting to see some data. There's a higher risk. So making sure you're taking your medications, making sure you're exercising, getting outside. It's a beautiful day today. Hopefully, people get to enjoy it. Those are all sound like simple things, but they're very important, and that's the data that we're seeing. Those are the people that get affected. So you can make a difference on how you'll do with if you were to unfortunately get COVID. You can make a difference on how you'll fare.
I think also what I've been trying to recommend is that now that we're in a very low prevalence time frame here in New London County and across the state, is now's the time to get your checkups and your visits and to make sure that you see your physician, whether it be through telehealth or you actually come into your specialist. So if you have a cardiologist, a pulmonologist, an endocrinologist, now's the time to make sure you see those physicians before the winter. In case, as Dr. Martinelli said, we see an uptick in cases. You want to make sure you have all your prescriptions renewed. You want to make sure that you've seen your physicians and you've had all your checkups. So if you are in a high risk category, you want to be in tip top shape going into the winter, where inevitably we're probably going to be seeing more cases. So it's very important. I would say anecdotally also, I'm very proud of New London County, and we just have not seen any non-compliance of mask use by the general public who have come to visit us at L&M. We're seeing a lot of outpatient volume. People are coming in for their mammograms and their preventive treatment. And I walk through the hospital all day long, and I think, Kevin, you would agree with me, is every person who visits our hospital as a patient is wearing a mask, and all of our staff members are compliant to mask use. So it's really inspiring to see, and I think it's part of the reason why our numbers are so low.
Great. A few more questions are coming in. As far as the hospital is concerned, where is the best and easiest way for a patient or potential patient to get a COVID test within your hospital system? And do they have to have a doctor's order, or can they just, is there some place where they can just go and get tested? Or is there multiple places maybe you could?
So generally we're having folks call their primary care doctors. They also can call, we have a hotline 1-833-ASK-YNHH. That's a hotline that can answer questions, and if appropriate and they feel necessary to order a test, they can order a test through that. That's usually the ways that folks get tested.
I can speak from personal experience. I've actually been tested twice, once in New Haven at Long Wharf when they had that mass testing site, the quick turnaround. That's no longer in operation, but CHC in New London and Shaw's Cove. You don't need a doctor's note. You don't need an appointment. All you need is identification. So you just drive up, get tested, and they tell you you'll get your results back in 2 to 3 days, although it's day 4 for me and I haven't heard from them. But it's very easy to do. It took about 20 minutes start to finish.
I think that, Steve, you just drive up. Is that what you said? I'm sorry.
Yeah. You see, if you just Google Community Health Center New London, it will bring you right to their website, and you just drive right up. And when I got there at 10 o'clock in the morning, I think there were 3 cars in front of me, and very efficient, well run. They do the typical nasal swab. So I'm not sure how long they're going to be doing that for. I believe they're open Monday through Friday, 9 to 1 p.m. if my memory serves.
Okay, I keep getting a lot of questions on, can anybody speak to the accuracy of the tests? It appears that maybe in the, obviously when the pandemic first hit, the test was new and it was evolving, but people are asking, is the test accurate? What's the accuracy level? I don't know if that's something that anybody can answer, but I know there's the fast rapid test. I don't know if that's the same as the nasal swab. Can anybody speak to that? Maybe infection control?
Yeah, I can answer that. I think for the tests that we're doing throughout the Yale New Haven Health System, it's a highly accurate test. We estimate that the sensitivity of the test, meaning its ability to identify the virus if it is there, is likely, around 95% or better. But one thing that's so important and allows it to be a very sensitive test is making sure that you get a good specimen. So when you do go to get tested, make sure you follow the directions and allow the person who's collecting the specimen from you or guiding you on how you collect the specimen, make sure you follow those directions really carefully. The test is also very specific. And what that means is that, while there are other coronaviruses that can just cause the common cold, this test is really not picking up those other viruses. And so it is a very accurate test. Now, there are other types of tests that some places are running that aren't quite as sensitive as that. It is, I think the primary thing is, do get tested if you think you need to get tested or you're being told to get tested, and make sure that the person collecting the specimen does a great job.
Yeah, and I would say too, with our local testing, our tests, the ones that we've used through our laboratory have been pretty sensitive, and the tests that'll be done at Lawrence Memorial and Wesley are tents that you drive through, and then the testing is done there.
I've been finding that typically somebody who drives through one of our tents gets the results back the same day, if not usually within 24 hours. So it's a very quick turnaround at our tents.
I'm sorry, 24 hours?
Typically right now, that's where we are. So like Kevin said, testing and testing platforms change, but right now our turnaround is less than 24 hours. So we've had some first responders recently that have gone through. I have a lot of contact with the community, and they came in the morning and they had their results by 2 p.m. is what they reported to me. So I think the turnaround is very quick right now.
Yeah, Donna's right. Our turnaround right now, we are sitting at about 24 hours, which is great. And we hope we can continue to do that.
That's terrific. So if somebody, I'm getting a message here, if somebody is coming from traveling from another state and has had a negative COVID test after 3 days, is staying home, can they come to your facility and get another COVID test to see if they are still COVID free?
Anybody who has a doctor's order for a COVID test can come and get tested.
Okay. Another question, any advice from the clinicians for those of us who have been social distancing and staying close to home, not going out and about because we are afraid of COVID, but now are facing with increased weight gain? It's like COVID-15 instead of the freshman 15.
The COVID-19 is what it is. It's we mentioned it before. You're right. Not only are you exercising and trying to get out, it's beautiful out. We're lucky it's this time of year. It's good for your health, obviously, losing weight or staying in shape. It's also mentally is the right thing. That's what's really important. I found, even for myself, I get home, just even a walk or something, it just breaks it up and you do feel better. It's important. Mental and physical health is key during all of this time.
Okay, another question, and I know that we're running over. We're just about an hour, but I appreciate you staying a little bit longer because we did get a little bit of a late start. So I have one more question, which is kind of to do with COVID, but deviates a little bit, which says, can the clinicians speak to the fact that for COVID, we should be going outside with a mask to avoid being inside and socially close to too many? However, how does that play into the fact that EEE may be right around the corner? Way to put you on the spot, right? Infection control. Do you want to speak to that?
Yeah. So EEE is the acronym for Eastern Equine Encephalitis, and this is another virus, and this virus is transmitted by mosquitoes. And, last year in Connecticut, we actually saw quite a bit of transmission of this virus. And unfortunately, this virus can cause a severe infection in people's brains. And there's unfortunately no medications that we have to treat that infection. So many of the individuals who get sick with that infection do pass away. Luckily, even though we did see more last year than what we normally see, the number is still very low. And actually, I think Stephen could probably tell us exactly what those numbers were in New London County. I think we have different threats around us. It is good to get outside to exercise. We do need to be wearing a mask and social distancing when we're around others. But it doesn't mean that we can't forget about things like mosquito-borne illnesses like EEE. And then, of course, Lyme disease is still out there. And so during the summertime, especially when we're spending time outside, we do have to take extra precautions to make sure we're not getting bitten by mosquitoes or getting tick bites.
Great. Thank you for that. So then I would just like to say, because we are coming up on time, thank you all. EEE is something that I know Senator Formica, who again is listening, just can't technically get on and doing a great job on EEE. That's something that he has been on the forefront of. It's something that he experienced a loss in his district last year, and it is a priority for him going forward. If you would all just like to maybe summarize on what we thought we knew a few months ago, where we are now with COVID, and any parting thoughts that you may have for those who are listening, that would be terrific. So in no particular order, I'm going to start in the way that I see you. So how about we could start with Dr. Torres? Would you like to say a few closing remarks?
Sure. I appreciate the opportunity to talk with everyone today. I think, we started a few months ago. We had a conversation. We sat with you, and things have changed dramatically. We've now learned that masks are a must. Washing your hands still stays the same. I'd emphasize everybody, like Donna had said, meet with your doctors, take your medications, exercise, get yourself in the best shape you possibly can. Connecticut has done a great job. We're really lucky. So hopefully that continues. Thank you for having us.
Thank you for being here. Steve Mansfield from Ledgely Health District.
I like to use the term cautiously optimistic. I think we've done a great job, especially in southeastern Connecticut, and it has so much to do with the people that are working to fight this pandemic and the cooperation that happens and the cooperation from our residents. That's a big chunk of what allows us to be where we are right now. But as I said before, this is the time to be diligent, to stick it out and pay attention to what's going on, because the last thing we want to do is go backwards. As I said, we're all tired of this, but we have to understand that it's going to be a long road in front of us regardless. And we just have to make it as easy as possible and do whatever we can to keep our morbidity and mortality levels as low as possible.
Great. The one thing I forgot to mention that on the vaccines, when you brought up the vaccines, Steve, was that the current law that we have here in the state of Connecticut during a public health emergency and a pandemic, if there were a vaccine available, it is within the governor's authorization to allow the DPH commissioner to mandate a vaccine so that everybody, including those going to school, would have to get the vaccine or they would not be allowed to attend school. So that is something under the current powers that we have now. There's a lot of confusion on that. And I wanted to make sure that we mentioned that concerning a potential COVID vaccine. So I thank you, because I know that you work just as much as everybody else here, 24 hours a day. You're always available. And Ledgely Health District has been an absolute integral part of the continuum of care in how we handle COVID. They train for this, and I just wish that we could have gotten you at the table sooner, but I'm glad you're there. So keep up the great work, and on a shoestring budget. So the next person that we have here is Donna Nucci in the order.
Hi, and thank you for asking us to be here. And I want to say that really working with my partners at Yale New Haven Health System and with Steve as well, I think that what we say on our huddles when we meet daily is reminding all of our staff members, because we have had so few employees be positive from any, we really feel like there's social distancing even when they're not at work, that it's important that everybody know that, like you said, it's really going to be a long marathon. So we're talking about another year. So try to really look at that and get creative with how you're exercising and staying healthy. I think it's really important. I know that when I talk to Ledgelight, I think I'd really like to encourage the public that if you are positive or feel like you might be positive and you're contacted by Ledgelight, one of the biggest things we can do in the community is to have 100% compliance to having contact tracing. So don't be afraid. If Ledgelight were to call you because you are positive, they're there to help you. And so we report to Ledgelight immediately any positives, and then they are contact tracing follow-up like they've been doing from the beginning, which has been a lot of hard work. And I think that's why New London County has stayed so low for as long as we have. So please make sure that you comply to the contact tracing and to the guidance from Ledgelight. So thank you.
Thank you for all that you do. Then we have Dr. Martinelli, please. Can you hear me?
Yes. Yeah. Thank you for the invitation to be part of this group today. I really appreciate everybody's interest in the subject. You know, I think as a takeaway, something that's so important, and you've heard us say this over the last hour, that while this virus is really in charge in many ways, I think what we've learned over the last several months is that when we work together, we can control it, and it's through everybody working together, making sure that we're social distancing, making sure we're wearing masks, washing our hands, and really taking the other public health behaviors that we know are effective in preventing the spread of the virus. And the last thing I'll say is that this has really allowed us, with all the work across our infection prevention team and with our colleagues at Yale New Haven Health, we're very proud to say we've really created a safe environment, and we want people to know that if you have needs, to see your primary care physician, to come to the hospital to get a test or have that surgery, please do not hesitate to do that. Speak with your physician, make sure that you get the care that you need.
Great, thank you. And I would like to thank all of you. And Patrick Green, if you are still on, would you like to say a few words? I know that you're, I see your name, but I'm not sure if you're still with us or not. Oh, there you are. Great. I want to thank you personally for giving us an opportunity to work with the hospital, to have the experts. I wasn't sure if you had scooted to another meeting, so I wanted to catch you before I went back to Kathleen O'Leary, to allow your experts to be with us today, to be with Senator Formica and I. So we wanted to just extend our appreciation, because we feel that there's nothing better than getting the information from the experts. A lot of the information you hear on the news, and even sometimes the executive orders are, they're conflicting or they don't make sense. So thank you, because you've been able to answer many of the questions, or your staff has today. And I want to thank you. And then I'm going to go to Katie.
Thank you, Senator. And again, you and Paul have been just tremendous in your support. I echo everything that my colleague said. It's been a challenging few months, but our staff have been heroic. They have been in this battle with us, and I owe a lot to them. And as Steve said, the community. This community has done everything possible, has sacrificed, and that their work and their sacrifices have really helped us slow the spread. But thank you for giving us the opportunity, and we're available to you to talk through any questions that you have in the future. Thank you.
Great. And then let's go to Katie. Katie, thank you for all that you do. You have a large available community that you are in charge of, and it's amazing to hear how few COVID cases we have and what great work the VNA is able to do. So we'd love to have you be able to give us some closing remarks too.
I certainly can't say anything better than Patrick and Rick and Kevin and Donna, who are all amazing colleagues. Just very humbled by, how well we've all worked together as a community. And for the group that I work with, many thanks for being supportive of our healthcare workers who come to work every day and take care of our frail elderly and homebound patients. And thank you again.
Great. Well, I appreciate it. And I hope everyone who has been able to tune in with us, and this will be on Facebook so you can rewatch it while you're home social distancing, has enjoyed this and has their questions answered. If you have not been able to get all your specific questions answered, we certainly can try to follow up with you with those answers. And we hope to continue this kind of outreach so that we can get the accurate and most current information to those. What we heard today was the hospital is a safe place for you to come and get your surgery and your procedure, that they have this amazing infection control protocols in place, and that it is very safe to have the VNA come to your door and help care for you, and that we have this excellent team here that is on top of the latest treatments and understands the fears and is here to quell those and make sure that you have the best health care that they can provide here in Southeastern Connecticut. So I thank you all for being here, and we look forward to our next update. So everyone have a great and safe afternoon.